Several Bay Area health directors urging everyone, even those fully vaccinated, to mask up indoors in public places.
Joining us now is Dr. Kirsten Bibbins-Domingo. She is chair of the epidemiology department at UCSF. Doctor, what do you make of these new mask recommendations?
Yeah, I think they're wise. I think our public health leaders in the Bay Area are trying to give us the warning. They're watching the rise, the uptick in cases. And even though the cases are low and the hospitalizations are low, there's clearly a trend for moving up. And in this environment, we have to be cautious. All of us have to do our part. And that is in the most risky environments indoors for all of us to mask up.
Yeah, you told us yesterday we got to keep an eye on those numbers, and here we are going for it. But at what point might we go the route of LA? We go from recommending to requiring the masks again.
Right. So LA has both a larger uptick in cases and hospitalizations, and they have a lower vaccination rate, frankly, than the Bay Area. And so I think LA wants to be cautious given the large size of the county, the large and more densely packed areas in the county. I think our public health officials will be watching closely, and once they see it happening, they might take other actions. But right now, recommending is just communicating to the public, be cautious.
Yeah, we know the Bay Area has a pretty good vaccination rate. Do you think it will be hard still wearing masks again to people who are already protected, who feel like they should have been able to throw them away?
Right. It's been the big discussion. Will asking people to wear masks somehow give people the idea that the vaccines aren't effective? It turns out in the Bay Area, I think people are mostly cautious, and you still see a high degree of mask wearing even before the word that came out today from the county public health officials. So I think you will see people adopting this. And mostly, I think what we want to make sure is that people are clear that the best thing that we can do, in addition to masking immediately, is making sure that those people who are still on the fence about vaccination really get vaccinated, because that's the most important thing to protect us against the virus.
I just sorted my masks into those I want to keep and those I want to get rid of. Now they're all going into the keep pile. So yeah, let's not rush this thing. But how much can we blame the spike in cases to that Delta variant? And there's these breakthrough cases we're seeing?
Right. So this is clearly a convergence of reopening, having good vaccination rates, but not perfect vaccination rates, in some parts of the state really having low vaccination rates, and then this Delta variant. The Delta variant moves just so much more quickly from one person to another person. And that combination is really proving to be much more than we thought it was going to be. And that's why we're making this change at this time. It turns out the vaccines are still highly effective in preventing vaccinated people from ending up in the hospital. The vast majority, 99% of the people in the hospital, really are those who are not vaccinated. And so the vaccines are effective.
That's key.
What about children, doctor? I mean, I know they are not eligible to be vaccinated yet. Should we be worried, though, this new variant could impact them disproportionately?
Well, I think one of the reasons why the recommendation is for everyone to mask indoors is precisely because a large proportion of the population who's not vaccinated can't be because they're children. And so we are wearing masks to protect ourselves. We're wearing masks to protect those around us who might not get full immunity from the vaccine because they have an immune compromised situation, and to protect those who are not vaccinated. And so all of those really are the reasons. For children, that is one of the reasons why they will be continuing to mask, because they don't have the protection.
And it's good to explain that to them. I mean, I had my granddaughter who was 11, and she said, "Why do you get to go without a mask and I have to wear a mask?" And, you know, she did understand when we laid it out.
I think many families are wearing their mask and have been for a while in solidarity with their children who are not fully protected. And that's the type of attitude we all have to have at this point.
No question. All right, Dr. Bibbins-Domingo, thank you so much for joining us this evening.
Always great info.